Hello everybody, this is Christi B, and welcome to my channel. I'm going to be reading to you Orthopedic Assessment in Massage Therapy by Whitney Lowe. Apparently this man is a god in the orthopedic assessment world, and for people who do not like to read the book or do not have his book, I hope you enjoy this as we go through the chapters and learn what orthopedic assessment is. All right. Chapter 1. Introduction to Assessment. Clients increasingly turn to soft tissue treatment for musculoskeletal pain and injuries as an alternative to mainstream interventions because of value and effectiveness. Consequently, massage treatment of soft tissue pain and injury conditions increased dramatically in the last decade and has become one of the most frequently used methods of complementary and alternative medicine in the United States. Massage is used not only by the massage practitioner, but also nurses, chiropractors, physical therapists, athletic trainers, occupational therapists, and osteophysicians. The majority of these problems are minor musculoskeletal disorders or pain conditions that do not require surgery. Massage therapy is a valuable complement to traditional treatment methods that focus on rest, exercise, rehabilitation, and activity modification. From everyday aches and pains to soft tissue disorders and injuries, massage is an effective method of treatment. For massage to provide these beneficial effects, the practitioner must be adequately trained. To move beyond relaxation massage to more advanced applications, the practitioner's skill base, knowledge, and experience must increase accordingly. Practitioners choosing spa or relaxation-oriented practices are also encouraged to adopt assessment protocols to provide improvement treatment. Learning assessment is a prerequisite to providing safe, effective, and targeted advanced massage therapy. Orthopedic Assessment in Massage Therapy, or OAMT, provides the first half of training requirements to treat minor musculoskeletal pain and injuries. This is for assessment. This aspect of the massage approach is a mandatory step, without which treatment would be a guessing game. The second half of training, advanced massage technique, and their applications and effects is presented in the companion text, Orthopedic Massage Theory and Technique. While a great deal of information about evaluating orthopedic conditions is presented in the OAMT text, the reader is encouraged to remember that not every soft tissue pain is an orthopedic disorder. It is essential to remember that the client's pain complaints may be some other than a common orthopedic disorder, such as a tumor, systemic disease, viscerosomatic reflux, or other pathologies. It is standard professional practice to refer the client when it is possible that a more serious condition is involved, or when treatment may be contraindicated. What is orthopedic assessment? Why do I need this? Assessment is an evaluation process, a systemic or systematic process of gathering information. Without knowing this information, treatment would be based on assumptions, not clinical reasoning. Assessment performs the following important functions: indicate which tissues are most likely involved, indicates the status of the involved tissues, directs the choice of the most appropriate treatments, helps determine progress towards treatment goals, determines if a client's condition falls within our scope of practice and expertise, helps distinguish both conditions that present with similar symptoms. Even with a physician's diagnosis, the practitioner is wise to perform their own evaluation in order to inform their treatment. Additionally, treatment should not be considered predetermined recipes. Rather, the individual characteristics of the client's condition should be explored for nuances that may alter the treatment protocol. Orthopedic assessment. Orthopedic assessment is the evaluation of soft tissue pain and injury conditions which fall into the classification of orthopedic conditions. The field of orthopedics is the medical specialty that deals with the primary tissues that create or limit movement in the body, or locomotive tissues. Rather than being only about the skeleton, as sometimes thought, orthopedics involves the entire musculoskeletal system, which includes muscles, nerves, fascia, tendon, ligaments, joints, and cartilage. Orthopedic conditions result from any number of activities and range from mild pain to cumulative trauma disorders, repetitive stress, to acute injury and/or chronic pain conditions. Assessment versus diagnosis. There is a distinct difference between assessment and diagnosis. A medical diagnosis is the identification of a disease, illness, a physician uses information gathered during assessment, along with other test results, to make a diagnosis. But the process of assessment in and of itself is not a diagnosis. Instead, whether performed by a physician or a massage therapist, assessment is simply a process of information gathering which the practitioner uses to develop a treatment plan. Massage practitioners do not have the scope of practice to make diagnosis. It is important for the practitioner to avoid telling the client they have a particular condition when no medical diagnosis has been performed. However, identifying the tissues involved and assessing their dysfunctions is within the scope of practice for massage and a necessary function for proper treatment. Learning to speak to the client in terms of tissues, functions, and locations is best. For example, possible median nerve impingement in the carpal tunnel versus carpal tunnel syndrome. This may feel awkward at first, but learning to articulate conditions in this manner actually trains one to think about tissues and their complexity, rather than boiling down a client's condition to code words and recipes. Benefits and functions of assessment. Assessment is a process of gathering information, for which the data is then used to make clinical decisions about treatment. It is an ongoing process that continues throughout the duration of the treatments. The basic rule of assessment is to rule out, not in, because one cannot know the true nature of a client's complaint until the evaluation occurs. One starts with a broad perspective, as the assessment, HOPRS, which is located in box 1.2, proceeds, tissues, and pathologies that don't fit the evaluation results or symptoms are ruled out. The evaluation narrows the possibilities and reveals the tissue involved or dysfunctional. Alright. So box 1.2 shows the components of orthopedic assessment. HOPRS is an acronym for history, observation, palpation, range of motion, and resistive tests, and S for specific orthopedic tests. Alright. Several functions are provided in the assessment. The most important reason for the massage practitioner to perform assessment is to determine if massage therapy is appropriate. Massage is not benign. It can produce significant tissue changes, which is why it functions as a form of soft tissue treatment. Ordinarily, these changes are positive. However, massage can be contraindicated, and the practitioner must be able to apply clinical reasoning to determine what results will likely come from massage, and if these are desired. Initial evaluation assesses the severity of a condition. Practitioners should refer clients whose pain or injury needs evaluation by another healthcare professional. Practitioners should also refer if their skill base or knowledge is not sufficient for a particular client's treatment. It is the responsibility of the practitioner to know his or her therapeutic limitations and capabilities. We're going to go over to box 1.1 real quick to show the benefits of orthopedic massage. Information derived from assessment is used to develop an appropriate treatment plan and provides a baseline in which to gauge treatment results and their effectiveness. General and initial questions answered by assessment: is massage appropriate? Could massage treatment be contraindicated? How severe or serious does the problem appear? Should the client be referred? Can the practitioner help the client? Information gained from the assessment. What are the client's symptoms? What is the client's history? What is the client's pain experience and level? What tissues are involved with the problem? How are the tissues involved? What biomechanical forces are in play? What are the structural aspects of the problem? What type of tissue damage has occurred, if any? Questions regarding the treatment plan. What type of treatment does the condition call for? What treatment goals are what treatment goals are reasonable to expect? How is the treatment progressing? Is the approach effective? Is it resolving symptoms? Is the condition stabilizing? Is this the goal? Are there any negative results from treatment? What new findings has the practitioner found? Is treatment still appropriate? Does the client need referring? Does the treatment plan need adapting? And can treatment be approved? These are all very good questions that you should be putting in your assessment, and that is why box 1.1 is shown to be the benefits of orthopedic massage. Assessment is primarily used to determine the tissues or structures involved and estimate their status. Massage treatments aim at reducing symptoms by addressing the causes. In the least, the practitioner determines whether the tissues involved are muscle, fascia, tendon, ligament, capsular, etc. In addition, the practitioner will evaluate the type of dysfunction in the tissue, whether it be a tear, hypertenacity, myofascial trigger point, nerve conduction impairment, etc., etc. Along these lines, the biomechanical forces that produce these tissues effects are estimated, for example, compressive load, excess tensile load, repetitive stress, and so forth. Without the diagnostic tools used by physicians, massage practitioners can never be fully sure about the nature of the client's condition. However, a basic idea can be formed that allows the practitioner to create a clinically reasoned treatment plan. Assessment also gauges the client's pain levels and symptoms. Evaluation allows the practitioner to get to know the client's symptoms, their pain levels and locations, movements, restrictions, and other symptoms. This information drives treatment choices such as what techniques to use and how, when, and what intensity level. It also allows the practitioner to gauge treatment progress. The assessment process builds the client-therapist relationship, and in-treatment questions help the practitioner keep track of the client's experience. In addition, the practitioner will develop a better understanding of the client's pain levels, threshold, and location. A practitioner who spends a little time creating a therapeutic and communicatively open environment with the client will have better results. Initial evaluation provides a baseline against which the progress can be measured. throughout the duration of the treatment, both within a single session and among multiple sessions. Ongoing assessment monitors the client's response to the treatment. It allows the practitioner to establish whether the treatment needs adapting or is proving to be beneficial. If the client has been referred, ongoing assessment can produce new findings or results which can be then shared with the referring physician. An important caveat, there we go. Caveats to assessment. An important caveat with assessment is that it is not an exact science. There are no specific evaluation techniques that can provide 100% positive results in establishing the tissues and dysfunctions involved. There are no specific evaluation techniques that can provide a 100% positive result in establishing the tissues and dysfunctions involved. In some cases, the nature of the client's pain is fairly straightforward. In other cases, assessment becomes an ongoing investigation that can result in changes in treatment. For example, the neck and arm pain, it might be fairly easy to establish that the client has hypertonicity in the upper back and neck from doing a repetitive task. But if the client has irregular arm symptoms of paresthesia and numbness, treatment will require more thoughts and evaluations. It is extremely important that immediate assumptions are not made. Numerous conditions have symptoms that mimic each other. Distinguishing between conditions with similar symptoms and presentations is paramount for effective treatment. In some cases, a reason for the client's complaints simply cannot be established. Regardless of experience or knowledge, the practitioner may not always be able to find a reason for the client's symptoms. In this case, continual exploration and monitoring and thinking outside of the box are the best approaches. If treatment is not working and the primary symptoms continue, referral to a more experienced healthcare professional may be advised. Orthopedic assessment skills are developed and require practice. Recent massage therapy graduates or those who have less experience will need to learn these new skills just as they did their entry-level training skills. With practice, practitioners will become more at ease in applying these procedures. Practitioners with more healthcare or massage experience will find the learning process and integration of these techniques into their practice easier. Students and practitioners will learn to combine their knowledge about tissues, pathology, and conditions with appropriate treatment approaches and critical thinking skills in their clinical practice. This text provides the practitioner a path towards these goals. Integrating assessment. Integrating assessment into the massage practice can feel awkward at first, but like any new skill, practice will improve efficiency and comfort. Practitioners often find that their clients are greatly appreciative and impressed by the care shown to them through assessment. Assessment has a wide range of application, from the simplest and quick inquiry to full-length testing. The practitioner will determine the extent of the assessment needed through the initial interview and history. Use these tips to help determine how and when to use these new skills. Why is the client seeking massage? Number 1. Why is the client seeking massage? Number 1. Why is the client seeking massage? The client may have a predetermined goal. Is that goal simple relaxation or treatment for a specific complaint? The initial interview, palpation, and history will reveal the level to which the assessment is advised. If none is, or if the request is a relaxation therapy, then put testing aside and focus on the evaluation of the client's tissue as you perform treatment. Number 2. If the client is seeking more specific treatment, or their history reveals the potential for a pain and injury pathology, then it is the role of the professional practitioner to advise the client on the benefits of further evaluation. Number 3, follow the HOPRS. I want to call it like hoppers. We're going to call it hoppers. Follow the hoppers protocol and systems laid out in this text. Begin with interview and history, but then move on to the palpation and basic tests. Use specific tests only if they are truly warranted. Do not skip range of motion testing. It is very, very important. The workhorses of assessment. Let's flip the page. There we go. The workhorse of assessment are these basic tests. They often provide more information than special tests. Number 4. Assessment often does not require a lengthy testing process. In many cases, a full-blown assessment may not be necessary. Efficiency will allow one to quickly jump to the appropriate assessment protocols. Take more time with the challenging conditions. Efficiency is the goal. Remember, the assessment is a skill. Number 5. Remember that assessment is a skill. Using the skills improves one's understanding of musculoskeletal conditions overall. With continued use and practice, assessment becomes more efficient and smooth. Number 6. In time, connections will be noted between various signs and symptoms, and the integration will almost lead itself into many cases. At the beginning, it will be difficult to know which clues are most relevant and which ones are not. This is where experience will come into play. After seeing similar conditions a number of times, the practitioner has an experiential background against which to see similar patterns and know that a particular case has similarities to others. As knowledge is combined with experience, the nature of the client's complaint is more accurately and quickly discovered. Clinical reasoning. The evaluation process is not about absolutes. They may be alternative interpretations of any clinical case, and a number of different ways to proceed with treatment for most conditions. Having an open mind and being able to reflect and question oneself when faced with more complex conditions is an important part of advanced work. The practitioner's eventual success relies strongly on their development of clinical reasoning skills. Clinical reasoning is the ability to reflect upon and analyze gained information and make responsible conclusions or decisions. In assessment, it is the ability to answer the critical questions about the client's conditions and treatment. Clinical reasoning questions would include: what happened? What tissues are likely involved? How or what forces were involved in the injury? How are the tissues involved? What is the physiological nature of the condition? What is the rehabilitation process for the injury? What role would soft tissue treatment play? What is the physiological nature of the treatment? Why would the chosen treatment work? How would it work? To answer these questions, familiarity with common conditions and their presentations, along with a working knowledge of anatomy, physiology, and kinesiology, is fundamental. In addition, equal knowledge of treatment techniques, how they work, and why is necessary. Remember that any client may have a combination of different factors or conditions present. Because variation conditions can occur simultaneously or mimic each other, the clinical reasoning process and assessment is a crucial skill for safe and effective treatment. Poorly evaluated conditions can result in inaccurate or inappropriate treatment. At the least, the treatment may be ineffective. At the worst, it could harm the client. The result of not engaging assessment or clinical reasoning skills may also lead a practitioner to miss the need for referral to another health professional. This error could have serious consequences for the client's health. How to use this book. This book streamlines the process of interpreting the large quantity of information that comes from assessment. Follow these basic guidelines that best use this text. To understand soft tissue injuries, it is essential to understand how the tissue functions in a healthy state as well as when they are injured. This is found in Chapter 2. The information in the chapter forms the groundwork for understanding the entire process of assessment. Chapter 3 presents the Hopper system, which is used for the framework for soft tissue assessment in this text. The remaining chapters cover the major regions of the body. The wealth of information on soft tissue disorders is organized into discrete conditions in order to provide a structure to aid learning and understanding. Each soft tissue pathology is structured in the Hopper's format so that users can learn about it in the same process as the evaluated in the clinic. Each regional chapter includes these elements: primary single-plan movements of that body region, condition overview and characteristics, Hopper's aspect of the conditions, suggestions for treatment. In addition, reference charts are provided to make looking up information easy while in the clinic. Primary muscle actions and single-plane movements. Knowing the basic muscle action is essential for evaluating pain with particular movements. Chart of major nerve trunks of the region and the muscle innervated by them. Charts of manual resistive tests most effective for emphasizing a particular muscle, the associative nerve root, and related primary motor nerve trunk. Knowing these greatly aid in interpreting neurological dysfunctions as well as muscle and tendon injury. There's much information to digest regarding the numerous orthopedic soft tissue pain and injury conditions. By no means should one expect to remember it all. Keep the text handy and use it as a reference tool to help guide clinical treatment decisions. Soft tissue evaluations forms the basis of any successful clinic massage treatment. Like a carpenter who must know how to use his tools or her tools appropriately, successful application of assessment principles sets the stage for the practitioner to be far more successful in treating both common conditions and advanced injuries or pain. And that is the end of Chapter 1, folks. Thank you so much for listening. I hope this is helpful, and stay tuned for Chapter 2, the soft tissues. All right, I will see you next time. Christi B out.